Hello, I'm Lauren Haldeman, Editor-in-Chief of the Journal of Nutrition Education and Behavior, where we are advancing research, policy, and practice. Each month, we select an article to feature with a press release and an accompanying podcast. And today's podcast article can be read in full at www.jneb.org for free for the next 3 months. And today, I'm really happy to be speaking with Dr. Dara LoBuono, who is the corresponding author for the article titled The Facilitators and Barriers to Digital Health for Managing Nutrition in People with Parkinson's Disease and Their Caregivers, a Formative Qualitative Study. I'm glad to have you here with us today, Dara.
Thank you for having me. I'm thrilled to be here.
Sure. And can you tell us a little bit about yourself?
Sure. So I am a registered dietitian and an assistant professor at Rowan University in the Department of Health and Exercise Science, located in Glassboro, New Jersey, so just outside of Philadelphia. My research has taken two different tracks, but primarily before coming to Rowan, my area of focus was around figuring out how to increase access to nutrition and health information for people with Parkinson's. Since coming to Rowan, I've kind of dovetailed a little bit, primarily two different research tracks, one working with adults with disabilities, particularly in the group home setting, figuring out how to increase access to fresh fruits and vegetable intake. This population does have lower diet quality compared to people without disability, as well as are more likely to be overweight or obese. We just finished up a project looking at how to train group home staff as well as day program staff on nutrition through social media. My other track has been more around older adults and training students in working with the older adult population around nutrition. So we are working with older adults at a family medicine clinic affiliated with Rowan University School of Medicine. And the students meet with them once a week to go over the MyPlate, so the basic food groups, but then also how to use the Start Simple with MyPlate app. And we are seeing that from our preliminary results, there has been an improvement in diet quality and fruit and vegetable intake. And I think a lot of that has to do not so much with the app, but I think that intergenerational interaction with the dietetic students meeting with that older adult once a week.
Great. Thanks very much. And so let's dive right in. Can you give us a brief overview of the paper that we've included today?
Sure. So when I was in graduate school thinking of a dissertation topic, I was very involved with the Parkinson's community. So I was involved with the American Parkinson's Association, Rhode Island chapter. I worked with one of my committee members on my dissertation, leading support groups for people with Parkinson's. And it was very clear that nutrition was needed in this population. A lot of them presented with side effects from medication that had nutrition implications. Changes in weight status are very common with the disease. So, but they weren't getting access to nutrition information. They weren't being referred to dietitians. And I think the biggest nutrition implication is that the main medication to manage Parkinson's, levodopa, can interact with dietary protein. So spacing out high protein meals and that medication is really important, but there's a lot of confusion around that. So when I was thinking of a topic, there really isn't, and this was pre-COVID, there really aren't nutrition interventions out there for people with Parkinson's, and they're already so busy with other therapies. So with Parkinson's, you want high repetition, high intensity. So speech therapy is 4 days a week. Physical therapy is 4 days a week. When is there time to sit with a dietitian? So that's where I thought of this idea of what if we figure out a way to design a digital intervention to bring nutrition to people with Parkinson's. So we started with a formative analysis doing home visits. So myself and an undergraduate student, we went to the homes of 20 people with Parkinson's and their caregivers. I refer to them as dyads. And one of the primary purpose that we looked at for this study was from those interviews that we conducted in the home, really understanding facilitators and barriers around digital adoption, specifically for managing nutrition. So our study was informed by the technology acceptance model, as well as the transition theory. So this idea of, we want to design a digital service that people are actually going to use and really understand their lived experience when informing the service. And then also, since this is a progressive disease, the caregiver's role is going to increase. So how do we help involve them in this journey? So with the interviews, they lasted somewhere between like 20 to, depending on how much people had to say, maybe 20 minutes to over an hour. And then we analyzed those qualitative interviews using an iterative approach to really look for those facilitators and barriers. From there, we did find about 6 facilitators that we felt would help, that got people with Parkinson's and their caregivers excited about technology. So this idea that they did see this benefit of being able to get knowledge and information very easily. If I want to Google, I remember one gentleman was like, if I want to Google how many calories are in a cup of blueberries, it's at my fingertips. Another facilitator was that they saw the convenience of technology. I remember vividly a participant talking about, I know that as my disease progresses and mobility declines, I'm not going to be able to get to the doctors as easily. I'm going to need some of those assistive devices maybe to remind me to turn off the stove. So seeing the convenience and to manage the disease without being overburdened. We also saw that if the dyad saw the benefit, or the benefit outweighed the cost of using the technology, they were open to using it. So if the doctor said, we really want you to try this because it will help you monitor gait, they were interested in trying it. A lot of our participants that were using technology were already using it to socialize. We also found that a lot of these with Parkinson's, community is very important. So many people get their information from support groups. So making sure that whatever digital service we develop, really making sure that that social component is there, whether it's talking with a dietitian or getting connected with other people in the community, and that it's enjoyable. So people that were using technology did see the enjoyment in it, or wanted to learn how to use it to be able to enjoy it. The last facilitator, and we were really debating if this was even really a theme, was forced adoption. So we did have 2 participants that were forced into using technology. So their doctor said, you have to use the patient portal. That's the only way that we're going to manage your records now. So for them, it kind of did feel like a tall order of, okay, I need to figure out how to use this technology. Barriers where we might see some lack of interest or willingness to use a digital nutrition platform really revolved around just general negative feelings and perceptions around technology. So some people felt that the information wasn't reliable from the internet. Some people felt like technology just in general wasn't reliable, that it never worked for them. They're always getting locked out of it. So why bother using it? And then information overload, this idea of I don't want to constantly get this much detail about my disease or know, what percentage of calories I'm getting from saturated fat. They just weren't interested in that level of detail. And then another big barrier was not knowing how to use the technology. So relying on a family member or, such as a spouse or a child to teach them how to use it. not being aware of what was out there. So there's so much out there, but people just don't know that it's out there and then how to apply that information. One barrier that I really want to highlight that came up was poor product design. And I think this is really important when thinking of a movement disorder such as Parkinson's. So we think of the resting tremor that people have with the disease. We think of how posture changes. And I remember clearly that one participant, their significant other bought them a water bottle, and it helped track, I think the water was a smart water bottle. It somehow linked with the phone. And because of how his posture is affected by the disease, he couldn't even really use the water bottle properly. The water was just falling out of his mouth when he was trying to use it. And he didn't have a smartphone anyway to connect to it. Or even like the Apple Watches, like it's too small for a participant to type on or log things. So they really did enjoy the tablet. They felt that that was the perfect size. And then I think just understanding how to apply information. So this population, they recognize there's a ton of information out there, but how does it apply to me? How do I use, this idea of spacing out something like my medication with my levodopa correctly in my day-to-day life? So really not understanding how to take that information and use it day to day. So those were the main findings that we had around facilitators and barriers for this study. But I think overall, the facilitators outweigh the cons if it's presented to this population in a light, showing the positive sides of it, empowering them to better manage their disease without it being too much of a burden for them.
Thanks very much for that, Dara. This is such interesting work and an excellent example of conducting a needs assessment, identifying that need, and translating that into application of that need. So I really, truly appreciate that. And I want to thank you for, again, focusing your work on a population that doesn't get much attention in the nutrition education literature. So I'm interested, what are your future plans as it relates to this line of research? Will you be continuing to work with Parkinson's disease management?
Yeah, so that's a great question. I think, right after I had finished my dissertation, I had all of these broad creative ideas. I want to design an app specifically for people with Parkinson's, or an intervention solely for people with Parkinson's. And now that I've been in the field for a few years, and I'm seeing that there's an app almost for everything now, and it is a lot of work to design an app. I am curious to see how we could use the Start Simple with My Plate app in this population, especially since we have developed more of this education component with it. So while the app isn't necessarily tailored to Parkinson's, the education component where they meet with a student, a dietetic student supervised by me, that could be tailored, start out in person, and then move into a remote setting, especially when we think about Parkinson's disease. One of the main, especially in the earlier phases of the disease, one of the main dietary patterns we promote is the Mediterranean diet. And while the dietary guidelines aren't necessarily Mediterranean, there is that big focus on the fruit, vegetables, and whole grains, which is perfect for this population. And since we are seeing this increase in fruits and vegetables in the older adults, I would be interested to see how this would impact people with Parkinson's. And it's a free app that's available to everyone. So it is accessible nationwide. We don't have to worry about designing this app and then getting it out there. So instead of reinventing the wheel, trying something that way, I think would be my next steps, and still including the informal caregiver Right now with our older adults, we are seeing that the older adults that enrolled with a spouse really appreciate having the support of the spouse and going through that journey together. So I think that will translate when we move this over to people with Parkinson's.
Right. You've got a nice trajectory ahead of you for this line of work. Is there anything else you'd like to say?
I just want to thank and acknowledge my dissertation committee, my major advisor, Dr. Ingrid Lofgren, who really, I wouldn't be where I am today without her. I had a great dissertation committee, Dr. Allison Tovar, Dr. Sky Liedel, Leslie Mahler, who's really, she's a speech language pathologist, barely invested in the Parkinson's population, and then Dr. Farangju, all at the University of Rhode Island. And then we did have 2 undergraduate students authored on this paper, which Kyla Shea and Megan Reed, which I really couldn't have done it without their hard work and curiosity in research.
Great. Well, thank you very much, Dara, for spending this time with me.
Thank you for having me.
And to all of our listeners, remember, you can read this article in full at www.jneb.org for free for the next 3 months.